Hey guys, what's up? It's Cheryl Dunn here from CORE Therapy and Pilates. It's about 11:40 Tuesday, and what I wanted to do is have a little quick discussion. This is a discussion I have in here very commonly, and it has to do with the hip flexors and the core. Now, what I find with the vast majority of my clients these days is they come in with back pain or neck pain, and they have their hip flexors, their psoas muscle and their iliacus muscle is very tight, and it's pulling them into this sway or this increased lordosis or an arch. Now, what I want to talk about a little bit is what's causing it and how do we change it. Okay, now what's causing that sway is the hip flexors. Again, it's the psoas and the iliacus. Now the psoas is going to be represented here, let me get these out of the way, by this yellow band. Now this yellow band right here, it's a TheraBand, it's representing the psoas. Now the iliacus is going to sit right in here on the pelvis bone there. Now what we're going to talk about is a way to think about how we want the core to work and not the hip flexors, because the hip flexors in my clients are overworking in most of the time, most of the cases. So I'm going to use an analogy of a wine barrel, and what I want to work is this barrel. Now this isn't a wine barrel, this is a little grid foam roller type of thing. But what we're going to think about is this barrel is going to represent, or this foam roller is going to represent what the core muscles and what should be working, okay? Now if we put that barrel right there, the bottom of the barrel represents the pelvic floor, okay? The top of the barrel represents the diaphragm. The front of the barrel represents the deep abdominal muscle, the transverse abdominus, and the back of the barrel represents the multifidus, or the multifidi that run up and down right here, okay? Now, what I find most commonly is that the barrel's not working on my clients, and the hip flexor, which sits right in the middle of the barrel, is basically doing all the work. So we need to get the hip flexor to turn off, and we need to get the barrel to turn on. And if we do that, we have a really good chance of solving back pain. So there's a lot of talk about the hip flexors, the psoas and whatnot, and yes, they are very involved. But if you stretch the psoas only, you're not doing very much. You have to stretch this guy. I think you have to release it. It's a little different than stretching it. Then you have to strengthen the barrel. And with that shift and that change of getting out of the hip flexors and into your actual proper core, you again have a much better chance of success in managing your back pain. So that's the story of the wine barrel and how it relates to the core, the transverse abdominus, the pelvic floor, the diaphragm, and the multifidus, and how the hip flexor is represented by this little band, this little PVC pipe, right in the center of the barrel. So again, we want the barrel working, not the hip flexor. All right, guys, that's it for today. I hope that makes sense. Comment below with any questions, and I'll get back with some answers to you. Take care. Have a great day. Bye now.